The second question is also a very practical one. It's not such a nice question, but it's from someone who is suffering from shoulder pain. And they just had an MRI done, and there is some stuff happening. But she's still asking and wondering how she can do the sexy shoulder template. And I would like for you to kind of like take us through the exercise, like really step by step, and maybe kind of like certain modifications you would do with someone who is in pain currently.
Okay, so first things first. I will have and will always only talk about non-traumatic issues,
Mhm.
right? If you have whatever, a fucking broken big arm bone or you've broken your collarbone, the sexy shoulder saver is not going to fix the bone. All right. So whenever you need like actual doctor, go and see a doctor, right? I'm talking about non-traumatic pain, which is stuff that slowly builds up over time. Starts with a little bit of nagging, like on the AC joint or whatever, rotator cuff or shoulder blade or biceps tendon, whatever it is. And basically you don't really pay attention to it, right? And it slowly builds up and it's kind of a non-brainer to think about in the beginning. But yeah, I'm feeling it a little bit doing push-ups, but pull-ups are totally fine. Like 3 months later, like yeah, it's starting to aggravate a little bit when I do pull-ups, and then you all of a sudden slowly narrowing down your exercise choices
Mhm.
because all of a sudden everything is painful. All right. The good news is anything that's non-traumatic that causes you pain can be reversed, right? And yes, we have to differentiate between, and I've actually just read a study about lower back pain, but it's the same with shoulder pain, which is a lot that is seen on MRIs. That means structural damages visibly being let's call it not assassinated, assessed.
Compromised.
Yeah, assessed on that MRI is true. The cool thing about the study is it's not always related to pain. So that means there's actual numbers behind this, which is a, I think it was 50%, like a very high number, almost 60% of people having uh, visual L5S1 spine issues were never in pain,
Mhm.
zero. Um, and vice versa, people who had actual pain um, did not see a structural damage on the MRI. I mean, let's
Mhm.
be honest. You'll see something on an MRI because there's life
Yeah.
and you're not a newborn and you've moved your body for like 20, 25, 30, 50, 60 years. And yes, there will be some stuff that's not as fresh as a daisy, like when you were 5 years old or 4 years old. Okay, that is totally fine. But just because there is a structural issue or a structural damage on that picture doesn't mean you have to be automatically in pain, and vice versa. So when your shoulder hurts, that doesn't mean there's a structural damage to it. And I've actually seen a lot of MRIs. So people come to me, be like, "Hey, Greg, my shoulder hurts." And we work with doctors because it makes sense to kind of get it checked out first. And they get an MRI, and the diagnosis is, well, basically, in very complicated language, they say, we can't find anything while your shoulder hurts,
Mhm.
right? Yes, minimal invasive um, rupture, partial rupture. So there's words that are going to be used that are going to try to explain the pain where it's coming from, right?
Mhm.
Again, you're 50 years old and your shoulder is not the one of a newborn. Cool. But there's not an actual explanation of why there is pain. So here's a theory of mine, which is okay, what if there's just a disconnect between what your body wants to do with your shoulder or what your body wants your shoulder to do and what you're actually doing? Um, Non-traumatic pain, start with the sexy shoulder savers and be aware of when the pain actually sets in. So
Mm.
in my world, I look at your shoulder and be like, okay, what's the biggest issue right now? Are you having pain squeezing your shoulder blades together? Are you having pain keeping your shoulder blades neutral? Or are you having pain when your shoulder blades move out to the side? That already tells me what we have to work on. So that means we'll go through the template and we'll see, okay, once we're paying attention to the details of which muscles have to fire when you pull the shoulder blades in, which muscles have to fire when you stabilize, et cetera, then we can make a plan. That doesn't mean the shoulder pain is going to be gone in one session or maybe not even in 6 weeks. What I'm looking for is the curve, the sinus curve that
Mm.
gets like lower and lower and smaller at the end. That's how, in my experience, pain actually works. It's not a on-off thing. It's not a, ooh, I was pain-free yesterday, and then the next day I'm like in fucking the sharpest pain and the most dreadful pain I've ever been in. It's slow buildup. And that's exactly how it's going to work the other way around.
Mm.
So when you're in a lot of pain and you're starting to do the right things, pain is slowly going to diminish, right? So we have the 24, 48-hour rule, which is, okay, we may aggravate the pain within the first 24 hours, but is it going to get less in 48 hours? If yes, we're on the right track. So don't freak out when the pain comes back or gets like sharper for like a couple of days. I'm looking for the big picture of like, okay, are we diminishing the amount of pain that you're in over the course of 2, 3, 4, 5, 6 weeks? If yes, we're on the winning streak. So start the template, pay attention to the shoulder rules, pay attention to which big muscles should fire, pay attention to the muscle jobs that we want to teach you in those templates, and observe for yourself if stuff gets better over at least 6 weeks. If no, reach out and maybe get some pointers alongside your whatever movement videos. Just get better at what you're doing. Again, this is non-traumatic pain. This is not when your shoulder bursts because you had a skiing accident.
Going back to the paper you mentioned at the beginning, is there kind of like an explanation as to why would
Nope.
you see that with, okay.
No, because literally we are we are tapping in the dark when it comes to pain, because sometimes it's totally irrational. Sometimes it can be explained with words and pictures and stuff we see on MRIs, but sometimes it's not, right? Um, Nobody can really explain like I don't know what's called in English, phantom pains. When you cut off one of your legs, you still feel the leg hurting, although it's not really there anymore. Because so that's weird.
Mhm.
And this is not the wound that's actually hurting. No, you can feel like pain on the backside of your leg that's gone, right?
Mhm.
It's totally irrational. It shouldn't be the case, but it still is. Um, um, my personal opinion is, just from my experience training people and solving some problems out there, is we don't have pain receptors per se, we have intensity receptors. So that means whenever the intensity gets too high and your body thinks you cannot manage the stress that's coming in, pain pain signals are probably the only time where we're actually going to start listening to your body, right? Because if there's no pain, it's like, all right, everything's fine, everything's good to go. Like, I'm doing good, and your body is not doing good. And at some point, it's like, okay, there's a danger coming up here. The danger in your shoulder is, okay, you're gonna get immobile. You can't hunt anymore. You can't carry the food home. Like, that's our ancestor brain. That's our mammal brains out there. Um, and that's gonna result in an issue because you're gonna die if you can't carry your food home.
Mhm.
All right, so I'm gonna have to remind you now. If you don't take care of that issue, shoulder issue, well, things could go sideways. All right, so you don't listen, obviously, because we're humans. We don't listen to pain signals, and so the body amps up the noise. So the pain gets bigger and bigger. Again, non-traumatic issues, not traumatic issues. Until you start listening, because once you cannot move your shoulder, well, god damn it, you're gonna start listening. Um, so we have to reverse that process and be like, okay, how can I reduce the intensity signals of the discrepancy between what I should be doing with my shoulder and what I'm currently doing, right? And I think that's what, in my small little world, in my small little book, I think that's what non-traumatic pain is in training.
Yeah, I was just now that you were talking about that, I was thinking about those cases that you see though oftentimes in a gym where people are like, okay, I feel pain somewhere, and then they need to take a break, and then it's like, okay, restart with lightweight, and once they again reach a certain weight, the problem is back again, and it's kind of like a uh, how do you say that? It's kind of like you're just turning in a circle, pretty much, and how frustrating that is.
Yeah, it's almost like a self-fulfilling prophecy because
Mhm.
the reducing the weight is one way to deal with it. I'm not a huge fan of it um, because it doesn't matter what you do; it matters how you do it. So let's take one example. You feel shoulder pain doing Chinese rows, whatever, at a certain fringe weight, right? Let's call it 50 kilos for 5 reps. Okay, cool. Everything until then is fine, and starting with 50 kilos, you start experiencing pain. Okay, that's weird because
Mm.
why does pain start at 50 kilos? That doesn't make any sense, right? But it's just okay, the weight and the exercise is just going to highlight at a certain threshold, 50 kilo in that case, that something is off. But that doesn't mean we can reduce to 10 kilos and pretend everything's fine now. That's just it's the same as when you get hunted by zombies and you just hide at home, pull down the sheets, and pretend they're not there. Everybody knows how zombie movies end, right? They uh, most of the times they find you and they kill you, whatever. But you can't pull the sheets down. And I think reducing the weight is just pulling the sheets down, although the zombies are still out there. So the only thing, and I'm trying to bring this out there, is understanding the principles of how the shoulder works, which position needs to be trained, which muscles are going to move the bones there, practicing this, and then fucking killing 50 kilos on the Chinese row. 50 kilos is not the problem. What you're doing with the shoulder is the problem. And I think this is just a lack of knowledge and not, I don't know, like discipline or motivation or pushing through or any of those bullshit phrases. I think it's just a lack of knowledge. So your shoulder doesn't know what to do when it comes to 50 kilos, but we can put a band-aid around it. Like my goal is, okay, I want to do it with 60 kilos and 70 kilos and 80 kilos. Not because of the PR or the muscles growing. No. Because we have to dig deeper into learning more to actually being able to move 70 kilos without any pain. So I think it's the most unhuman approach ever
Mm.
to reduce weight to make you feel good about it. This is pulling the sheets down when the zombies are out there and you're gonna get with the Chinese roll, not literally, but with the zombies, you're gonna literally get killed at the end,
Mm.
right? So sticking with the zombie knowledge, I'm sorry, with the zombie analogy is the only way out of the zombie apocalypse is you have to kill the zombies. That's it. You have to get better at killing zombies, and that's the same with the shoulder. You have to get better at learning the shoulder positions, learning where your shoulder blade needs to be, learning where your elbow needs to be, learning how to engage the lats and the muscles. And no, don't uh, exit strategy to your traps and don't do this.
Mm.
This is practicing. This is the only way out of shoulder pain, and this is the only way out of a zombie apocalypse.
That's a good end word.
Famous last words. All right, guys. If you wanna escape the zombie apocalypse with me, that's great. That's cool. I want to educate you how to kill all the zombies out there, and maybe also have less shoulder pain while doing Chinese rolls for 50 kilos. Hang tight. Book's almost ready. There's a workshop coming up in July. I'm trying to get my shit together and do like more advanced head up workshop announcements so you don't have like 3 weeks in advance, which is fine. So I'm gonna do one in September, around September 6th. Um, Join me for the zombie apocalypse, kill some zombies, and get your shoulders straight. Take care and see you next time.